Whatever. Hi. My name is Iraima Hernandez. I'm from Venezuela. I became an American citizen. I came to the U.S. When I was 21 years old. I went to New York City to the Cambridge School of Languages for my English. I have hairy cell leukemia, which is a very rare cancer, and also, breast cancer. Leukemia is a blood disease that develops in the bone marrow. The type that I have is very rare. That doesn't usually happen in women, and it happens in men. Hairy cell is a very slow blood disease. They told me that I had hairy cell leukemia back in, I believe it was 1995. I was 34 or 35. I was very afraid, and of course I cried. I cried because I didn't know what to expect, from the treatment or from what was going to happen to me. Of course, the hardest part was that, being a mom and having, my daughter being 5 years old, it was very hard for me because I didn't know what was going to happen. With the leukemia, yes. The leukemia was, I was always tired, but the main symptom that I had was that I was bruising a lot. Anything that I did, or if I hit my leg, very, slightly to the table or anything, I got a big bruise. So even though that I went to my physical, do my physical once a year, and my blood count was good, I knew that there's something was wrong with me because of the bruising and feeling, so tired. When I first knew about the hairy cell, I decided, the doctor said that the best thing to do was to have a 7-day treatment, chemotherapy. They treated me with a drug called 2-CDA, and that's a small version, name for the drug. And so I did it for 7 days, and after that, they did a bone marrow biopsy, and the leukemia basically was gone. So it was a very successful treatment. Not too many side effects from it. I didn't lose my hair, or I just felt tired because when they do those kind of treatments, everything goes down to, your immune system basically goes down to nothing. I was in remission, I did it the first time, and I was in remission for 10 years. And then after this, 10-year mark, the leukemia relapsed, and so it came back again. I haven't done anything with it yet, only because the doctors feel that now we are dealing with two issues, which is the hairy cell leukemia and the breast cancer. So, because of my counts, my blood counts, remember the leukemia is a blood, disease, and because of my blood count being semi-normal, they feel that the less drugs that I put in my body, the better for me, only because they don't want to wake up the breast cancer. If for some reason my log is too low, and then they have to treat me right away. But I go to the doctor every 6 weeks, and they monitor my blood, counts, like my white cells and my red cells, my hemoglobin, my platelet counts, and I was determined, and I just did a treatment, and I had a lot of support for my husband and the family and friends, and I got through it. Breast cancer basically is, cancer cells that develops in the breast, and they form, tumors, or, it can be, small ones, depends on, what kind of breast cancer. They have different, names for the breast cancer cells. Mine, it was, because it was so early, it was, I think it's a carcinoma, but I just don't know. Breast cancer, it was back in 2004. It was the same reaction, but it was a very surprise news, to me, because, having to to live a healthy life, and, it just happened. It was very scary because breast cancer is it's a very, the breast cancer can go anywhere, and it's a very serious cancer compared to the hairy cell leukemia. I went to a couple years, like in 2002, when I turned 40, I started, developing, doing mammograms. And then the mammograms show calcifications in the breast. Every year there were more and more calcifications in the breast, in the right breast, and it can be, when you get older, that happens in the breast, or it can be that it's something wrong, that is happening into the breast. So that's why women have mammograms, and that's why it's so important to have mammograms, because they can see, what the breast is, is doing. No, I didn't have no changes in I didn't notice any different in the breast. But again, I kept, because of the calcifications showing in the mammogram, I never gave up to, to make sure that I have my physical done, every 3 months, only because of the hairy cell leukemia. And, until, the calcifications were there were so many in the dry breast that the doctor, the oncologist surgeon, decided to do a biopsy into the calcifications, and that's how they found the tumor, a very small tumor in the right breast. Breast cancer, like I said, is no how long you have it. It's just basically, when I signed out in 2004, I did a lumpectomy and I did a mastectomy. That was, the first year that they told me that I had, the breast cancer. And then, at this point, the breast cancer is in remission. Okay, it has been, 7 years now, but, Lumpectomy is when the doctors go to find out where the tumor is. The surgeon and the radiologist doctors work together, and they do like I said, that procedure, and it's to determine, where the tumor is and how big it is, and what kind of breast cancer also, so they determine all that. Also, when they do, most of the time, when they do lumpectomies, they do they check for your lymph nodes, which is, they make sure that, they are negative, and so they can negative or positive. And I was, they
Negative or positive for what?
for cancer.
Okay.
Okay, so meaning when they do that, when they take the few of the lymph nodes, in my case it was, under my right breast, under my armpit. It was only because they wanted to make sure that the cancer wasn't spread to the, to all other part of the body. And fortunately for me, they were negative. And then after they did the lumpectomy and they assured me that I have breast cancer and it was a very small tumor, they gave me options. You do the mastectomy, or we do another lumpectomy with radiation. The doctors felt because I was in good health.
Oh, okay.
They didn't want to do the radiation treatment. So my decision was to do a mastectomy, and a mastectomy is when you remove the breast tissue, from the breast. So that was, my decision, because I felt better by doing that and removing, everything. Again, it was hard because it was something that I needed to think again, and to remove a breast or a part of your body. It was a very hard decision for me, especially when it came to the breast. But, on the other hand, by me doing that, it's been 7 years and I'm still here.
Hello everyone, my name is Ariana. I just wanted to take the time now to say thank you for watching my video. Not everybody knows what cancer patients go through. This video is a little generalized, but I'm sure, or I hope, that you have learned something new. Anyways, I wish you all a great rest of the year, and I hope that you stay healthy. Thank you again.